Poor back posture, slouching or sitting for long hours can impact your back. So we have 24 bones in our back, and these are divided between with the soft cartilage. When with the age, overuse or wrong usage of back, people can have back pain with the degenerative conditions. There are certain structural deformities which can cause back pain. Number one could be the slip disc or disc herniation. People can also have sciatica associated with back pain. Even scoliosis, the deviation from the back bones, also can cause back pain. So why is that people get back pain? Number one, it could be obesity and a very bad lifestyle. Number two could be very long sitting hours. So they are sitting for a very long time, not doing exercise can be one of the reasons for having back pain. Number three could be hereditary factors. If your parents or somebody in the family is suffering from back pain or spondylosis, you could get it in an early age. Other than this, pregnancy, heavyweight women have more tendency towards getting back pain. Also, people who had a previous injury, for example, if they had accidents or a muscle cramp or anything related to back, the previous injuries can get diverted and have a spondylosis in a later stages of life. What Ayurveda suggests for having these kind of back pains? As I said initially, in case of acute conditions, it is very easy to tackle. All you need to do is just take one oil massage or a simple Ayurveda pain management treatments, and you will be fine within 2 to 3 days. But if you are suffering from a chronic back pain for a very long time, as I said, it could be a degenerative conditions or a disc herniation, then you need to see and consult a doctor and plan strategically how to manage these pains for a long-term benefit. Number one, in these conditions you should do is first rejuvenate the joints. As I said, cartilage diminishes with the age. So the more you get aged, the more chances of having back pain are higher. Other than these, you need to also change your behavioral and lifestyle pattern. If you are sitting for very long hours, you should make sure that you get up in between, walk for some time, do back exercises or change your chair, reduce your weight to reduce your back pain. Let us see what are the symptoms you get in back pain. Number one, some people get continuous sharp pain in the back area. It will be only in the lower back area. But if nerves are associated along with L1 and L2 or L4, L5, then the pain can radiate to your leg, which will be a kind of nagging pain. We could also do an examination of straight leg raise, wherein we will know that the nerves are involved and the person will get leg pain along with back pain. Other than this, they will have a tingling sensation, inflammation, difficulty in sitting down and getting up. All these symptoms will be there in chronic back pain. Ayurveda suggests long-term pain management with the different kind of therapies. Number one, as I said, Kati Basti, a special treatment done for lumbar spondylosis on the back. Wherever there is a pain, a structure like formed with the help of oil, and these warm medicated pain relieving oil will give an instant relief up to 50 to 60% within the first 1 week. Apart from this, if you are having a nerve involvement or a nerve compression in the back pain, then you need to make sure that you take a proper Panchakarma treatment like Basti, Anuvasana Basti, rejuvenating Bastis or even Virechana to reduce weight. Once you lose weight, improve your structural deformity, inflammation and other things, the back pain will automatically come down. During your intense back pain stages, that is if you have an acute pain and a chronic pain, one thing you need to do is avoid exercising. You need to rest. You need to rest as much as possible. You need to make sure that you sleep on a coir bed or a hard bed. This over a period of time will help in reducing the back pain. So coming to the treatments, once we do the Panchakarma treatments to the back, the next stage would be changing in the lifestyle pattern, diet and also medications. As Ayurveda suggests, there are many multiple medications which will help in relieving the pain, improving the cartilage degeneration and also giving strength to bone and muscles. These kind of medications, which are not the exact painkillers, will help in long-term management of the pain. As you know, for a back pain, we just take a painkillers, pop it, 6 to 8 hours you don't have a back pain, and then you get back to your same problem. Rather than going to this method, you need to make sure that you treat the root cause. If your root cause is compression, if your root cause is the wrong posture, if your root cause is some other diseases, then make sure that these things are rectified before doing anything else. Another best way to tackle back pain would be yoga. Why yoga? Yoga is not a very fast exercise wherein you will be twisting and turning your back. Yoga is associated with the breathing patterns. So a person with the back pain can get a therapeutic yoga exercises which will help in strengthening the back. Certain asanas, camel pose, serpent pose, all these poses help in strengthening your back muscles. Back stretches and exercises are extremely important, especially spine lengthening. If you start doing exercises, lift your arm, leg, stretch yourself as much as possible. This will give the spacing and lengthening exercises help in reducing the back pain. There are many people who will undergo surgeries or planning for surgeries. So my advice is, only before you take any major decisions, first diagnose what is the reason for your back pain, how you can tackle it, how to improve with physiotherapy, Ayurveda, yoga, and then you don't have to go for surgery if you are on a proper back pain treatments. There are certain oils in Ayurveda which will help in reducing the back pain. It could be Mahanarayana Taila, Pinda Taila, Sahacharadi Taila, multiple combination of oils which on a regular basis, if you apply to back, also reduces your back pain. So how do you identify if it's a chronic back pain and acute back pain? Acute back pain, you can get it in a sudden jerk movements, some accidents, or it could be very sudden within a short period of time. It may stay from a week to 2 months, up to 2 months. And sometimes acute back pain where inflammation is there, massage is not advised. People think back pain means I should take a massage. No, in these conditions there are special treatments called dhara which will help, or a different kind of massages which will help, which is not giving pressure to the body. So these kind of acute back pains have to be tackled in a different way. Even cold packs should be applied to the acute back pains. Wherein chronic back pains are the back pains which last more than 3 months and will have a chronic impact or a degeneration in the backbone. These needs to be managed for a long term. And as I said, clubbing, yoga therapies, diet and Ayurveda treatments help in long-term management of the back pain. In these conditions of chronic back pain, the person who is suffering, if he is able to take a weekly one oil massage, it benefits for a long-term strengthening of the back. Also, as I said, certain dharas, katibasti, massages, patrapinda sweda, churnapinda sweda, all these different kind of Ayurveda therapies help in managing the long-term back pain. So let us not suffer. Make sure that you don't make back pain as your reason for not living life. If you want to live life, happy life, without any pains, then we are here.